Mediconnect was created in response to the death of a lady called Debbie Headsbeath, who died from a prescription drug overdose of mass addiction to codeine. And as a consequence of that, we discovered that she had 18 online accounts. None of those accounts knew of each other's existence, or the doctors, and so this is a classic example of the problem of not being able to have a single source that doctors can go to and pharmacists to check that somebody has already been prescribed drugs beforehand and the right drugs. And that's the problem, the first problem that Mediconnect's solving. As of Tuesday a week ago, there's now a new regulation which raises the bar, so we're just in the right place at the right time. And sitting behind that is another regulation on drug recall for fake drugs, so fraudulent drugs. And so we are just starting discussions also, not just with the pharmacies, but also with the pharmaceutical companies to join up the information for that. So sitting behind that, we then have a couple of blockchains, one of which provides the transaction history, and the other one deals with a cryptocurrency called Meditoken, and which is doing an ICO at the moment. That will complete at the end of September. That's when the platform will be live. And we then have a 3-year plan, which we're just going to be discussing with the NHS next week, to look to scale up eventually to all pharmacies in the country.
The benefits to the NHS are multiple. Let's start with the GPs. So the GPs have improved confidence that the information they see on the record, so the distributed ledger technology in this instance, are actually the actual record of the patient, whether they visited the hospital, they visited a private GP or any other healthcare provider. So they have increased confidence that the prescriptions they may provide and the care they provide to the patient is specific to that patient and appropriate. Let's look at it from the patient perspective as well. So the distributed ledger technology will improve the patient confidence within the whole system for a variety of reasons, 2 of which are, if you have a drug recall, at the moment I have to ring up individual patients, which on my list could be up to 4,000 patients, and tell them, you may have a problem with your medication, can you please check? That reduces confidence hugely in the system, simply because if you were a patient and somebody told you may have a problem, you always have a question mark on that medication and you're less likely to take it, which will result in potentially the patient not taking that medication, and if it's a heart medication, for example, they could be admitted to hospital through a heart attack. The other thing is as well is that where we have false medications in the system, this will reduce the overall impact of false medicines because it's a seamless system. We know from the manufacturer through the wholesaler, through the pharmacy, to the patient, the overall supply chain of that medication. We know it from a rigorous standpoint, so the patient can have confidence that what they are getting is the proper drug and the right time and the right location for them. In addition to the benefits to the patient and the GPs, there are also benefits to the manufacturer as well, because the data which has been produced from the patient, the GP, the pharmacy records will allow targeted information, anonymised, to be filtered back to the manufacturer themselves. They then can reduce costs by improved efficiencies in marketing, in distribution, and also through deals localised within NHS, which will allow for cost cutting.